Hi, my name is April Blair, and I'm wanting to speak with you today about the discussion that was in week 2. One of the two things that did stand out to me was the fact that quality control as well as communication to the key players was not done well in this scenario. And the communication would be with the internal key players as well as the external key players. One of the things that I like to speak with you, and this is from the CDC, is in reference to how to prevent or how to address and have corrective actions when dealing with a scenario similar to this. One of them is to what safeguards are needed to prevent the root cause from happening again. Also, what would be some of the contributing factors which might trigger the root cause to reoccur? And then how could the CAP lab director prevent this from happening again? And then overall, what could be some process changes? Because this is a good event or scenario that happened for them to be able to understand some of the weak points within the communication chain within the CAP lab and the CAP department. So how could they change the way they have done things in the past, and to make sure that it never happens again? The two things that really stuck out to me was the fact of there was a lot of not wanting to be vulnerable to what was going on and being sensitive to the patient. It seemed as if there was a lot of covering up and a lot of wanting to take things as if they did not happen and not really address the issue head on. Part of being a good healthcare administrator, you have to also be able to be willing to discover those things that even though you might not be okay or comfortable with the results of what you find or the outcome, but to also be fair and continue to move forward with trying to find out those things that you thought might be in place, but they were not. And this scenario was a very good example of what was not really in place in that department as far as communication and being able to have some type of quality control in place. First thing that sticks out to me, no one really took the time to confirm that that patient was the actual patient that was not getting the stent. I think because of the schedule, sometimes patients are not always on time. Sometimes patients or cath labs go over a little longer than others. So the issue was the patient wasn't really clearly identified. And it was very clear based on what the directors stated that the department at that particular day was kind of overwhelmed and swamped with the bookings that they had for that day. The other issue was that once they realized what was identified, no one took the time to have the courtesy to notify the family and let them be aware of what was going on. And I believe one of the issues was because the family was aware that something was going wrong due to the observation took a lot longer than what was normal or what they were informed how long the observation would take. So that was one of the other things too that they had to realize and ask a lot of questions. And I believe this made the director a little nervous and not being willing to accept the challenge or accept the confrontation or whatever anticipated were to happen, and just be honest with the family and transparent about what was going on. I really liked the way that the quality control person was handling the situation. And I really think that if there is some harm done within a root cause, that it could be minimized with the effect of failure on the resident. I believe it could have been minimized had there been some time or some effort put into being transparent and acknowledging what was not properly taken care of and provide corrective actions to move forward with how to address the issue. Thank you.